I want you to walk into your bathroom, stand in front of the mirror, and turn your head slightly to the left. Look at the right side of your neck, specifically the area between your ear and your collarbone. You might see a muscle there, the sternocleidomastoid, running diagonally. But I want you to look just behind that muscle. Do you see a pulse? Not the hard, thumping kick of your carotid artery, but a soft, fluttering, wave-like motion under the skin. Or perhaps, more concerningly, do you see a distinct, rope-like blue bulge that stays there even when you are calm and breathing normally? We often ignore our necks. We look at our faces for wrinkles, we look at our teeth, but we rarely pay attention to the plumbing that runs vertically between our head and our chest. We assume that if a vein is sticking out, we are just straining, or maybe we are angry, or maybe it is just a sign of getting older and having thinner skin. I am here to tell you that a bulging vein in your neck is not a skin issue. It is not a muscle issue. It is a direct, real-time pressure gauge reading from inside your heart. That vein, the internal jugular vein, is like a dipstick for the engine of your cardiovascular system. It connects directly to the right atrium of your heart without any valves in between. This means that whatever is happening inside the right side of your heart is reflected instantly and visibly in your neck. If that vein is bulging, or distended, it means the pressure inside your heart is dangerously high. It means your heart is struggling to accept the blood returning from your body. It is often the very first visible sign of right-sided heart failure or a failing tricuspid valve. Today, we are going to learn how to read this gauge. We are going to perform the mirror test properly, because angles matter. We are going to explain why your ankles might be swelling at the same time your neck is bulging. And we are going to discuss the treatments that can relieve this pressure before your heart wears itself out. By the end of this video, you will look at your neck not just as a body part, but as a dashboard for your survival. To understand why this vein matters so much, we have to visualize the heart as a house with 4 rooms. The 2 rooms on the top are the atria, and the 2 on the bottom are the ventricles. The right side of the heart has a very specific job. Its job is to receive the used blood, the blue blood that has circulated through your body and is depleted of oxygen, and pump it over to the lungs to get a fresh supply of oxygen. The blood comes from your brain, your arms, and your legs, travels through the vena cava, and dumps into the right atrium. From there, it goes through a door called the tricuspid valve into the right ventricle, which pumps it to the lungs. In a healthy heart, this flows like a wide, lazy river. The pressure is low. The blood flows down from the neck into the heart effortlessly. Gravity helps it. You should not see the jugular vein bulging when you are standing or sitting up because the blood drains instantly. However, if the right side of the heart is sick, or stiff, or failing, the river backs up. It is like a clogged drain in a sink. If the water cannot go down the drain fast enough, it rises in the basin. The right atrium is the drain. The jugular vein is the pipe leading to it. If the pressure in the atrium rises, the blood creates a traffic jam all the way back up to your ear. That visible column of blood is what doctors call jugular vein distension, or JVD. Why does the pressure rise? The most common culprit in the 60-plus population is a leaky valve. The tricuspid valve. This is the door between the upper and lower chamber on the right side. It is supposed to snap shut every time the heart beats to prevent blood from flowing backward. But as we age, or if we have had heart issues in the past, the ring of tissue around that valve can stretch. The door no longer fits the frame. It becomes floppy. This is called tricuspid regurgitation. Here is what happens: your heart squeezes to pump blood to the lungs. But because the door is leaky, some of the blood shoots backward, the wrong way, up into the atrium and up into the veins of your neck. Every time your heart beats, you might see the vein in your neck pulse or bulge. It is literally the shock wave of the backward blood flow. You are seeing the mechanical failure of the valve reflected in your skin. But the valve isn't the only cause. Sometimes the pump itself is just too weak or too stiff to handle the volume. This is right-sided heart failure. It can be caused by long-term high blood pressure, or commonly, by lung issues. If you have COPD, emphysema, or sleep apnea, the arteries in your lungs are tight. The right side of the heart has to push incredibly hard to get blood into those stiff lungs. Eventually, the heart muscle gets tired. It dilates. It fails. When it fails, the fluid backs up. It backs up into the neck, showing as JVD. This is a condition that rarely travels alone. If the blood is backing up into your neck, it is also backing up into the rest of your body. This brings us to the wet symptoms. Think of your body as a water balloon. If you keep filling it and the pump can't empty it, the water has to go somewhere. Gravity pulls it down. So, the most common partner to the bulging neck vein is the swollen ankle. Edema. Do your socks leave a deep ring in your calves? Do your feet look like rising dough by the end of the day? If you have swollen feet and bulging neck veins, you have a systemic fluid overload problem. Your heart is drowning. It also backs up into your abdomen. Specifically, your liver. The liver is a sponge that sits right under the heart. If the heart is full, the liver swells with blood. This can cause a dull, aching pain in the upper right side of your belly. You might feel full after eating only a few bites of food because your swollen liver is pressing on your stomach. This is a condition called cardiac cirrhosis or congestive hepatopathy. It is not caused by alcohol, it is caused by the heart. If you have neck veins, swollen ankles, and a loss of appetite, your body is screaming that the volume is too high. So, how do you distinguish this dangerous bulge from a normal vein? Everyone has veins. If you are singing opera, or lifting a heavy box, or straining on the toilet, your neck veins will bulge. That is normal physiological pressure. The danger sign is when the vein is distended when you are resting. Here is how to perform the JVD self-test at home. You cannot do this standing up, and you cannot do it lying flat. You need to use geometry. Step 1, go to your bed or a reclining chair. You need to be positioned at a 45-degree angle. This is crucial. Prop yourself up on 2 or 3 pillows so your torso is halfway between flat and upright. Step 2, relax your neck. Lean your head back into the pillow. Do not tense your neck muscles. If you tense, you hide the vein. Step 3, turn your head slightly to the left. We are going to look at the right side of the neck, as it is a straighter shot to the heart. Step 4, use a flashlight or the light from your phone. Shine it across your neck tangentially, from the side, to create shadows. Step 5, look for the movement. You are looking for a pulsation just above the collarbone. If you see a flutter that travels up the neck, that is the jugular vein. Now, interpret what you see. In a healthy person at a 45-degree angle, the top of that fluid column should be hidden behind the collarbone. You shouldn't see the vein bulging up the neck. If you can see the vein filling up more than 3 or 4 centimeters above your collarbone, if it reaches halfway up your neck or all the way to your jawline, while you are in this semi-reclined position, that is a positive JVD sign. That means your central venous pressure is too high. It is important to distinguish this from the carotid artery. The carotid artery also pulses in the neck. But the carotid has a strong, singular, kick. It pushes out. The jugular vein has a soft, double-wave flutter. And here is the key test: if you take a deep breath in, a healthy jugular vein should collapse and disappear because the suction of your lungs pulls the blood down. If you take a deep breath in and the vein gets bigger or stays the same, a phenomenon called Kussmaul's sign, that is a major red flag for severe heart restriction or stiffness. Why is this so important for the 60-plus demographic? Because we often blame these symptoms on just getting old. We get short of breath walking to the mailbox and think, I'm out of shape. We see our ankles swell and think, I ate too much salt. We ignore the neck because we think it's just wrinkles or skin changes. But untreated right-sided heart failure is progressive. It damages the liver. It damages the kidneys. It makes your life smaller and smaller as you lose the energy to move. Recognizing the neck vein gives you a head start. It allows you to catch the failure while it is still manageable with medication. Let's talk about the "why now" factor. Why does this happen as we age? The tricuspid valve is often called the forgotten valve. For years, doctors focused only on the left side of the heart, the side that pumps to the body, because that is where heart attacks happen. But we are living longer now. And the longer we live, the more wear and tear this right-sided valve endures. Also, many of us have had pacemakers installed. The pacemaker leads, wires, often have to pass through the tricuspid valve to get to the ventricle. Sometimes, simply having that wire there keeps the door propped open slightly, causing the leak. If you have a pacemaker and you develop neck swelling, you need to ask your cardiologist to check the valve function. So, what is the solution? If you see the bulge, do you panic? No. You act. The treatment for this condition is often very effective, especially if caught early. The first line of defense is diuretics. Water pills. Furosemide, Lasix, or similar drugs. These medications tell your kidneys to open the floodgates and release the excess fluid from your body. By reducing the total volume of fluid in your system, you lower the pressure in the pipes. The river level goes down. The ankle swelling disappears. And, if you watch closely, the neck vein will flatten out. It is visible proof that the medicine is working. Monitoring your neck vein is actually a great way to know if you are taking the right amount of diuretic. The second step is managing the salt. I know, we hear this all the time. But for someone with JVD, salt is not just a seasoning, it is a magnet. Sodium holds on to water. If you have a leaky valve and you eat a bag of potato chips or a can of high-sodium soup, you are flooding your system with fluid that your heart cannot pump. You will see the result in your neck within hours. The low-sodium lifestyle is the non-negotiable partner to the medication. But what if the valve is severely damaged? In the past, fixing a tricuspid valve required open-heart surgery. It was a major, risky operation, and surgeons were hesitant to do it on older patients. But we are in a new era of medicine. We now have transcatheter procedures. This means they can repair the valve without cracking your chest open. They go in through a vein in your leg, thread a catheter up to your heart, and clip the valve leaflets together to stop the leak. Or they can replace the valve entirely through the catheter. These procedures, like the TriClip, are game changers for seniors. The recovery time is days, not months. You don't have to live with the failure, you can fix the mechanical problem. There is another condition that can cause bulging neck veins that is terrifying but rare, superior vena cava syndrome. This happens when a tumor in the chest, usually lung cancer, presses on the main vein returning blood to the heart. If your neck veins are bulging and your face feels swollen and you have a new cough, this is an urgent scan situation. It means the pipe is being squeezed from the outside. While less common than heart failure, it underscores why you cannot ignore a change in your neck. I want to address the psychological barrier. Why do we avoid looking? We avoid it because we are afraid of what we will find. We are afraid of the words heart failure. But I want you to reframe that term. Heart failure does not mean your heart has stopped. It means your heart needs help. It means it is working inefficiently. It is a chronic condition that can be managed for decades. People live full, active lives with managed heart failure. The tragedy is the unmanaged kind, the kind where you drown in your own fluids because you didn't want to admit something was wrong. Think of the JVD check as part of your morning hygiene. You brush your teeth. You wash your face. You check your neck. It takes 5 seconds. Look in the mirror. Turn your head. Is it flat? Good. Is it bulging? Okay, let's check the ankles. Let's check the weight. Rapid weight gain of 3 or 4 pounds in a couple of days is fluid, not fat. If you see the signs, call the doctor. Say specifically, I have noticed my jugular veins are distended. This tells the doctor you are educated. It tells them this is not a vague complaint, it is a specific clinical observation. It moves you to the front of the line. Let's talk about the silent progression. Many people with tricuspid regurgitation feel fine for a long time. They subconsciously adapt. They walk slower. They take the elevator instead of the stairs. They stop gardening. They attribute it to age. They don't realize their capacity is shrinking until they are in crisis. The neck vein is the whistleblower. It tells on the heart before the heart fully gives up. It gives you the chance to intervene while you still have reserve capacity. I also want to mention hydration in a nuanced way. We are told to drink water. But if you have JVD, you might be told to restrict fluids. This is hard. It feels counterintuitive. But water is healthy. In a closed system that is overflowing, adding more water, even healthy water, is dangerous. You have to follow your cardiologist's fluid restriction guidelines strictly. Sucking on ice chips or eating cold grapes can help with the thirst without overloading the volume. Let's visualize the anatomy one more time so it sticks. The right heart is the receiving dock. The tricuspid valve is the loading bay door. The jugular vein is the approach road. If the door is broken, the trucks back up onto the road. The traffic jam is visible from the sky, the mirror. Your job is to keep the traffic moving. If you are noticing this bulge and you are also feeling a fluttering in your chest, that could be atrial fibrillation, a fib. A fib often causes the right atrium to quiver and stretch, which can worsen the valve leak. The two conditions feed each other. Treating the rhythm issue can sometimes help the valve issue. It is all connected. This is empowering information. You don't need a medical degree to see a bulging tube. You just need to know where to look. So, tonight, before you go to bed, set up your pillows. Lie back. Take your flashlight. Look at your neck. It might be the most important self-exam you do. If you see the flutter, if you see the bulge, don't be afraid. Be grateful. Be grateful that your body gave you a sign. Be grateful that we have diuretics and valve clips. Be grateful that you caught it before you ended up in the emergency room breathless. Your heart works hard for you. It beats 100,000 times a day. If the right side is struggling, it will wave a flag in your neck. Don't look away. Wave back, acknowledge it, and get it the help it needs. You have a lot of life left to live, and you need a strong pump to enjoy it. Thank you for listening. Keep your eyes open, keep your salt low, and take care of that precious heart.